I got a presentation about the principles and the practical design of a facial rejuvenation and lifting using the non-contour PDO thread. I wrote this illustrated atlas for PDO thread lifting and the botulinum toxin with my friend, Professor Hee-Jin Kim, and the dermatologist Yoon Jeung Hyun, and me. My design photos are taken from this illustrated atlas book. As you know, this is the aging face. Aging face have so many problems. As you can see, thinning of the dermis and epidermis, and adipose fat tissues are redistributed, and more sparse, and loosening of the retinacular cutis. And bone also reabsorbed, and facial bone is changed to small. So we have to many combination methods like this one to treat layer 1, EBD, and the other polymers and toxin, cosmetics. And to improve the layer 2, we also can use the EBD, laser, and RF and HIF, and the other injectables. Layer 3, we can also combine with injectables and thread lift. And for layer 4, deep layer, we can also treat with the other EBD, especially interstitial laser and HIF and RF and thread. So when you perform the PDO thread lift, you have to choose the patient face, more adjustable face. This face have the a little sagging face, and have a groove, and a little thick skin, and no adhesion, no mild depression, and overround face line. In this case, I inject a PDO thread on her face. Her face is changed like this. So if you want to make a good result for the patient, you always you select a good patient. And this is a little relative contraindication. Fatty and more sagging square shape face, and very loose skin. This kind of face, I always refer to the plastic surgeon, because this case, if you insert thread and injectables, can improve the skin textures and wrinkles, but the patient cannot agree this result. So you have to refer to the plastic surgeon. And as you know, the thread can be divided two types. First one is a contour thread. Contour thread always use the bidirectional coax thread. And the second is the non-contour PDO thread. Non-contour thread also divided into two types. First one is the floating thread, and the second is the fixation thread. I always use these two types, floating thread and the fixation thread. This is monofilament thread. Monofilament thread also have no core, and so non-contour PDO thread and the floating type non-contour PDO thread. And scaffold. In the morning, I explained this thread functions and role. This thread also have no core, make more volume in the early stage, and excrete so many growth factors in the tissues. So this is also floating type non-contour thread. This is multiple bidirectional coax thread. Multiple bidirectional coax thread hold the tissue and prevent the droop down the skin. So I usually use for the jawline lifting and marionette line and submandibular line lifting. And the other type is this is punching thread. This rhomboidal shape play like a bidirectional curve. So holding power is better than the multiple bidirectional curve thread and more thick. So I usually use it for mid-face tightening and lifting. This journal, I wrote this journal about 16 years ago. And this result is very important because we didn't know when we inject the thread, we didn't know how the thread play a role in the tissues. But after this result, this journal, we can approve the results. First one is the make a new collagen fibers. In this mesenteric stain, so many newly made collagen fibers accumulate around the thread, and also, as you can see, so many inflammatory cells accumulate around the thread. And new collagen fiber merging with the prior existing collagen fiber. That is very important. Later, that merging effect change to the fibrous bridging. And as you can see, 3 months later, loose collagen fiber tissues change to dense and contract. So when we insert the only monofilament thread in the tissues, but patient face more tighten and lift. So this phenomenon is very important. And also, as you can see, around the adipocyte is denatured and disappeared slowly, gradually, as past the time. And this is a very important slide for PDO thread lifting. Name is fibrous bridging. Fibrous bridging is a newly made retinacular cutis. So already I said to you, aging phase reduces the collagen fibers and more sparse and loosening of the retinacular cutis. So we have to increase the collagen fibers and make a new retinacular cutis. This retinacular cutis hanging the skin on the bone. So we make this fibrous bridging in the subcutaneous layer. So we did the PDO thread lift. That time always keep the similar depths and similar interval. It's very important to same more effective result. We get the effective result. And A line area is a thread insertion site. B line is a not inserted area. There's fat tissue thickness is also decreased about 20%. So when we insert the PDO thread in the tissue, fat tissues are biodegraded and observed. So after thread lifting, use the monofilament PDO and the bidirectional curved thread or the other multiple bidirectional curved thread, whole kinds of thread broke down the adipocyte and reduced the fat volume. So patient later, about 6 months later, they always said my face changed to small and more tightened because of the reduced fat volume and make a new retinacular cutis in the tissues. And we estimated so many growth factors. As you can see, after 1 month later, after 1 month, about more than 20 times increased growth factor. And 3 months later, about 5 to 10 times increased. 6 months later, whole kinds of PDO thread biodegraded and observed in the tissue after 6 months. So that excretion rate is very fastly decreased after 6 months later. Finally, we get this result. When we insert the PDO thread making a new collagen fibers and make a fibrous bridging, excrete so many growth factors and adipocyte lysis. So when we insert the PDO thread for the skin and subcutaneous layer and face or body, we can observe the same phenomenon. So in the early stage, we reduce the fat volume in the arm and calf area and masseter area and submandibular double chin area. And we tighten with this thread, more tighten up and more displace the malar area more over the displacement. So this is the thread have the vector. So we insert the PDO thread, make a new collagen fibers, but that collagen fibers are very loose. This loose collagen fiber change to dense and contract. So monofilament have the vector along the axis line. Target layer is the subcutaneous layer, especially above the SMAS layer. Sometimes we target to the muscle and reduce the contraction power. And sometimes we use a submuscular layer. Main target layer is there. And as you can see, whole kinds of thread located on the SMAS and subcutaneous layer. And only one thread, scaffold, is located placed in the submuscular layer. I already showed this tumescent solution. Before I treatment, I always inject the tumescent solution on the lateral face and the infrorbital nerve block and the mentalis nerve block. And then make this supine position. Jaw thrust, the supine position is very important. This thread is cannot lift the skin intentionally. So we have to make this position and insert the thread. This thread fixed in the upside of the face. And the patient stand up. This thread prevents droop down the skin and gradually tighten the skin. That is that make a final result lifting face and tighten face. This is designed for the infraorbital wrinkles. In this time, I usually use monofilament PDO. Average 5 thread insert subdermal layer. And this design also, some patients don't want botulinum toxin. This case, I insert the PDO thread in the claw feet area. Lift again about 6 months interval. We can improve the fine wrinkles and reduce the contraction power in the claw feet area. And this is for the natural fold. Insertion entrance point is the hairline. Hairline is the entrance point. And this 3 thread or 2 thread have to pass the medial boundary. Before PDO thread lifting, I always wind the medial boundary. Medial boundary starts from the lateral canthus vertical extension line and the nasolabial fold and lower boundary. Lower boundary starts from the mouth corner to earlobe and marionette line. And finally, we check the mandibular line. And then I design and insert. This is also the other design for the nasolabial fold. This is for the jaw. When you insert this area, this point is very important because this point improve the mouth corner and the jaw and the marionette, upper marionette area. So if you want to insert a small amount of thread for thread lifting, I recommend this area is very important. 1, 2, 3, and for the natural fold, 1, 2. 1, 2, 3, 4, 5 thread is very important. And for theater of deformity, depending on the groove depth, insert more. Deep groove, I insert more, but average, I insert about 3 to 4 thread insert around the theater area. And to rejuvenate the mala area, insert the end scaffold. This end scaffold also have to pass the natural bare fold, because this thread in the early stage cannot make the collagen fibers, but as pass the time, make a new collagen fibers and change to hard. This hardly change this thread, play like a straw and bar. So if you insert this thread before the natural bare fold, when the patient smile, that time this thread pushing the skin and sometimes it comes out through the skin. So you have to pass the natural bare fold is very important to treat this thread lifting procedure. This is for the marionette line. This is for the marionette line. I usually use multiple bidirectional coax thread. This thread is have to pass the marionette line because same reason. And first thread have to pass the lower vermilion border. And this is a simple technique for the natural bare fold. I sometimes use this technique. Patients don't want downtime, but improve the natural bare fold, especially upper marionette line. I insert this end scaffold along the vermilion border and 1.5 below area and 1 cm below area, insert the end scaffold in that area. And the other, this is a very simple and effective technique for the natural bare fold and the jaw. I usually use dermaspring eye. This is a monofilament PDO thread. This monofilament PDO thread inserts this pattern fanning technique. Make a puncture in the 4 point and insert the 4 thread, and the second one insert the 3 thread, 2 thread, and finally 1 thread insert there. That thread make a mesh in that area. That mesh prevent the pushing the skin and more tighten. So no downtime and effectively improve the loose skin and the jaw fat and the marionette line. And the final one is this design. This area insertion is very important because so many threads lift up the skin and lift back and lift up, but some patients a little bit more loose skin. The patient have the loose skin. You have to pass the first thread insert along the mandibular line, and second one is the 1 cm below the first line, and the third thread insert the submandibular area. This thread lifting very sharply change the mandibular line. Let's see the video. Make a puncture with the 18 gauge. And I always use the N-fix, multiple punching thread. I design the boundary, medial boundary, low boundary, mandibular line, nasal bare fold, marionette line. And this cannula touch the medial boundary and bend down and more deeply insert the thread and touching the nasal bare fold and remove the cannula. Left side also same. And cut. This is for the jaw. First thread insert the cross area and the second thread, third thread. Step by step, you insert along the design. Insertion depth is always a subcutaneous layer. This is for the nasal fold, marionette line. This area is, you have to pay attention not to injure the parotid gland. Parotid gland located in here and here. So you have to pay attention not to injure the parotid gland. So insert along the skin. And this thread, this cannula have to pass the marionette line. For teardrop, as you can see, this cannula have to pass the medial obiculus retaining ligament. Because this end scaffold is have no curve, so very movable. The patient express the face. So you have to insert the thread submuscular layer and have to pass the medial boundary of the obiculus retaining ligament. And insert for the nasolabial fold. This thread improve the malar area. For the nose, this is collagen. And touch the bone and inject the collagen. And then insert the thread. Collagen have several advantages, especially HA filler sometimes make more widen the nasal dojum as pass the time, and very translucent, a little bit Tyndall effect on the nose, but collagen never made this effect. More sharply augmented nasal dojum and puncture the 18 gauge and insert the Y-core. Y-core also multi and unidirectional core combination thread. For the nasal dojum, and this is for the submandibular line. Entrance point starts from the mastoid process low boundary, and this area very hard to insert because practice molecular fascia located in here. So when you insert this area, a little spinning the cannula and step by step advance this cannula to the marionette line and insert the first one along the mandibular boundary, and the second one insert 1 centimeter underneath of the first line. This is the simple technique for the nasolabial fold. This is the end scaffold. Thread along the lower vermilion border. Have to pass the nasolabial marionette line. Second one also insert underneath of the first thread and cut. This is stem ladder fan technique, SF technique. Puncture 4 points. And this is the dermal spring eye. First, second, third. and remove step by step and insert. Remove and insert. Lift again and make a mesh in the jaw area. If you want to reduce the fat volume, more twisting this cannula in one direction. And he has the claw fit. Very young guy. So I inject smooth solution. And the infraptal overlock. This is a more fine dermal spring eye. Insert the subdermal layer. And insert reversely to make a mesh. Low reed wrinkle, insert fanning technique. Same technique. So this is the demonstrated patient. Her face, immediately after, her face a little bit edematous, but jaw and marionette and nasolabial fold more lift up, and lower malar fat composition is over the displacement more. And 3D EVG. This patient did thread lifting, and 3 weeks later, her face changed more sharp and more round shape, oval round shape, and improved the nasolabial fold and the lower malar areas wrinkle. And her face also a little fatty face, but more sharp and more smaller change after thread lift. And as you can see, this animation showed gradually skin is more tightened change. Lower malar volume is decreased as past the time. And her face also have more sharp mandibular line and more over the displacement of the lower malar fat pad, and more overround shape and tighten, and improve the skin tone and color, because PDO thread also excretes so many growth factors in the tissues. So aging phase, you have to use so many combination techniques, sandwich technique, PDO thread, and the PLLA, EBD, and the other machines, and they have to reinforce the retinacular cutis using the fibrous bridging, and reduce the fat volume, especially lower malar and jaw area and submandibular area. And PDO thread also polymer. So produce so much growth factors in the tissue. So have to use this phenomenon. So thread lift and rejuvenation have to performed based on the animal experiment result. Thank you for your attention.
Thank you very much. Yes, can I just have you any questions please write on your piece of paper, and obviously give any chance to ask those questions, and of course, later on we'll have a networking session right after this breakout session. We're going to call our colleagues as well from the equipment development later to join us, so that also gives you some time to